Change Lives for Good with your host, Greg Kepferle.
Healthcare is in the news a lot these days, especially with the Affordable Care Act and the challenges of its rollout. But healthcare is much more than what sort of health insurance you're able to get or how to find the right doctor. Healthcare involves healthy living, healthy aging, and healthy communities. And with us today is Fred Ferrer from the Health Trust to talk about what the Health Trust is doing. Hello, my name is Greg Kepferle, CEO of Catholic Charities of Santa Clara County, and I'm in conversation with Fred Ferrer, CEO of the Health Trust, on Change Lives for Good, where we look at innovative solutions to fighting poverty in Silicon Valley. So welcome, Fred. Glad you're here.
Thanks, Greg. Thank you. Good to be here.
So at the Health Trust, you say you want to make Silicon Valley the healthiest region in America. Well, I mean, aren't we really healthy here? So what does the Health Trust do to make that vision come true?
Well, if you look at our vision of making Silicon Valley the healthiest place in America, we really want to make it that for everyone, and that's really the challenge. Silicon Valley is the healthiest, wealthiest, and wisest place probably on the globe, but the challenge is that that's not shared by everyone here. And so you really have kind of the tale of two cities. You have the wealth and the education and the strength of the resources that are here. We've got great weather, we've got great education, we have great jobs, a strong economy. So we have all the ingredients for really a healthy community. And yet that's not shared by everyone. We also have some of the greatest poverty, some of the greatest homelessness. We have infant death mortality. There's lots of our statistics that don't look good to everyone in our community. So that's the challenge here. With this great wealth, can we really raise the level of health for everyone in the valley so everyone shares in that, as opposed to only the people that have all the resources now?
So what's the role of the Health Trust in making that happen? So you see that disparity. It's a real challenge for us that, living in Silicon Valley. What are you doing about it?
Well, at the Health Trust, we like to get upstream, because in some ways we can look at health care and the medical treatment of folks as being one aspect of it, and an important one. And the Affordable Care Act, or Obamacare, has done a lot to be able to say if people have insurance, they'll be able to get the preventative care they need from the doctor, and they'll also be able to get services when they actually get sick. So insurance is an important part of an important ingredient in this kind of solution, but insurance alone really doesn't make you healthy. So everybody in the country could have insurance tomorrow, we won't be one iota healthier. So what is it that makes us healthier? Well, if we look upstream and we ask the question, well, why are people getting sick in the first place? And why are these particular populations getting sick or more likely to be sick than others? What's the ingredients? And what we call that is the social determinants of health. Those things that really determine your health are your education, your income. Do you have a really good job or not? Where do you live? What's the environment look like? What's the pollution where you live? Those are the determinants. Those are the social things that determine really the biggest effect on your health.
So you're saying that if I live close to a freeway, if I don't have a good education, if I don't have a good job, then depending upon where I live, I'm more likely to have poor health.
Not only are you likely to have poor health, you have your life expectancy is shorter. So we can map and we can show by zip code where those folks who live longer as opposed to those folks who don't. And when we start to look at why, what's the determinant, what's going on behind that, those are the kinds of elements we see. We look at this built environment, the physical environment, and say, well, what's going on here? Well, if you don't have grocery stores, if your neighborhood's not safe, if you can't walk anywhere, much less get out and play or be in a park or have recreation, if you're afraid kind of for your life because of the safety issues, if gangs are intervening in your neighborhoods, if you don't have a good job and you don't have income, so the only access to food you have is kind of the food sloughs that we have in many of our low-income neighborhoods, where you have access to junk food, fast food, a liquor store, a convenience store. Like, if that's really where your environment, it's not a surprise then that you don't have good health.
That seems like such a daunting task that you have to change whole communities then to make that happen. And you've got to tackle education, you've got to tackle safety, you've got to tackle healthcare, nutrition, income, jobs. I mean, that's a huge challenge just to address healthcare.
It is, except we're Silicon Valley.
Okay.
We're not afraid of huge challenges here, right? We're the home of Apple and Facebook, and the innovation that we have here in our valley, the resource that we have, the capacity to really think differently, to think bigger and broader, is to be able to say, if we can't do it here, if we can't address these preventable strategies, if we can't address these issues here in Silicon Valley, then where could you? So for us, it is a big and it's a daunting task, but it's one that we think is solvable if you use the research, if you know the science, if you think through the strategies, and then you really start to innovate and start to say, well, we know what works. How do we then invest in those things that work? So that we can look at things like education and to see, we have great schools here, but why are they not great for everyone? And what are those tools, what are those resources, what are those strategies that we need to incorporate to improve all our schools, to make them all the kinds of schools that we'd want any of our own children to go to? If we look at the healthcare system, there's a lot of bureaucracy in it, there's a lot of challenges with it. So what do we do to streamline that? What do we do to really make that work for people? And then most of our health care doesn't take place in the doctor's office. So if you go to the neighborhoods and you start to see what are those resources, what are those community assets that you'd really want to be able to take advantage of? What's in your neighborhood that you can have access to? And if we start to look at things as neighborhoods where people really live, then we've got all kinds of great strategies of how you make those interventions. Whether you be an older person, which is the fastest growing population in Silicon Valley. Older adults are going to be far more the population than young families with children, which has been the tradition here for many, many years. We're starting to see this real shift so that older adults will become the real majority of the population. We're not ready for them.
No,
our systems
we're not.
aren't ready for them. Our services aren't ready for them. And the baby boomer of today is not going to look at a senior center the same kind of way. A baby boomer today that's retiring is looking for an encore career. Many low-income people don't have the ability or capacity financially to retire. So they're going to continue to work much longer. So what are the support services that we should be designing, and what's the built environment look like? If you look at something like the American with Disabilities Act, who would ever thought that every curb, for the most part in our country, would be wheelchair accessible? Who would ever thought you would actually change the built environment? You would actually go change the sidewalks. I'm sure that when the first President Bush signed that bill into law, I'm sure people said, "You got to be kidding! That's too big. What would that really look like?" And yet today, it's taken for granted here that the community with disabilities has access. Now, we still have a long way to go in that fight as well. But if you can make these choices, if you can make the design of the way you're thinking part of how you do things, then all of a sudden those large challenges become much more, they become much more in the bite-sized pieces that we can really look at. San Jose is one of the best recycling cities in the country. We recycle here better than almost any city in the country. And I always think of that as a good example. Why? Was it because we have great marketing? Was it because we are so conservation thoughtful? Is it because we really love the land and we're really good stewards and guardians? No. It's because we have blue garbage cans. It's because our garbage system is systemized it to be making it recycling is the easiest thing. If I have to drive down the street to be able to take my recyclables, I won't do it. But if I'm throwing them in the blue garbage can and that's just being part of the regular pickup cycle, then recycling becomes really natural to me. It becomes the choice, the default choice, the easiest choice. So if we look at things like food access, it's the same kind of thing. If you have access to really healthy food, if you have access to fruits and vegetables, it's going to be the default choice. If all you have is access to junk food, that becomes the easy choice as well. So when we look at this system, when we look at kind of the whole community, what do we try to say? Like, what can we do to make health the easy choice? We can make health the natural default. I do it naturally. I didn't even think about it. And as I say, recycling to me is always the best example, because if you recycle here and you just get used to that habit, go to an airport, any other airport in the country where they don't recycle, and you have a water bottle and you're like, oh, what do I do with this? I don't want to just throw it in the garbage. Where's the recycling, right? Habit happens after this default or this easy position goes over and over again. You just get in the habit of recycling. When you take that away, you go to the airport that doesn't have recycling, all of a sudden you're like, it jars you because it becomes your habit. And we want to make health the same kind of habit here for everyone.
But to make health that habit, it sounds like you mentioned the word innovation, that you've got to innovate. You've got to disrupt the existing system to change it so that you find an easier alternative that people then adopt and then make that their habit.
Well, at the Health Trust, we really believe that this, Silicon Valley is the valley of innovation. So what does that look like? How could we look at that as we look at health and the health services that affect Santa Clara County? And so 2 years ago, we brought Dr. Clay Christensen out from the Harvard Business School. And we had Dr. Christensen speak to nonprofit leaders, electeds, and funders, a lot of the foundations and the charitable funders here in the Valley, to have this conversation about what would disruptive innovation look like. And they'll talk about what that means. But our goal at the Health Trust was to be able to say, first of all, we don't think that government funding is going to come back in the way it has been in the past. We also don't think that the needs of the community are going to lessen. The effects of the recession are long-lasting. Underemployment and unemployment hit the low-income sector hardest and the longest. So even though we see recovery in the tech community and we see the overall economics of the community going well, which is awesome, what we don't see is that lower-income community sharing in that kind of a wealth. So if you have this continuation of increased need, if you have less government support, and we see with sequestration and other things that this is something that's going to last for a while, then what do we do? Because as nonprofit leaders, we have a responsibility to address the needs of the community. We don't get to just say, well, too bad the government's not funding these things anymore, so sorry, we can't provide those services anymore. We have a huge chronic homeless challenge here in this valley. We have a really serious and endemic issue around how do we serve older adults. We cannot afford the kind of oral health that we provide to children is abysmal. Right? We have these really serious endemic problems here that we can't just say, well, sorry, we don't know what to do. So Dr. Christensen's theory that he has looked at in the for-profit world, we also asked him to apply to the nonprofit world. How do we look at government services and the services that we provide to the community, especially low-income communities? How can we look at that from a disruptive innovation perspective? So disruptive innovation, there's lots of good examples of it, but let me describe kind of the points of it. First of all, it's trying to say, right now you have nothing, you have no service, you don't have anything at all. What would be good enough? What could we bring in? Not the best service, but what would be good enough? And what would that good enough be able to do for a lot more people? So we want to look at a market, a group of people that don't have anything right now, and what could we do that's just good enough? Secondly, how to use technology to be able to do that in an affordable way. And then finally, how do you put all that kind of together in a place, in a system that actually makes the big change to the bigger system when the bigger system doesn't like it? That's the disruption. So we know a lot about innovation here. We improve things all the time. But how do you then disrupt that system so the system itself has to respond? It's not going to be easy to do because the systems don't like it when you fight back. So I'll give you an example. 10 years ago, the only way that you could get your teeth whitened was to go to a very expensive specialist. Your insurance probably didn't pay for it. He had very special equipment, and that's how he could whiten your teeth. So the only people that could afford to whiten their teeth were the Hollywood movie stars, right? So then what happened? Crest, all the toothpaste companies, they came in and they started developing the Crest White Strip using technology. It's not as good as the best equipment is, but it's good enough. And it opens up to every market. Now I can go to the grocery store and buy Crest White Strips. As soon as you do that, the big systems themselves start to say, hey, but that's not as good as what I'm doing. It's that's the challenge. When you see that, that's the disruptor. And every time we see that in cell phones and landlines. The cell phone really disrupted the landline systems of telephones. Like all of those ways that we start to disrupt the system gives us that opportunity for key innovations and sustainable change in our systems.
So we'll be back in a minute with Fred Ferrer to talk about all of this disruptive innovation that the Health Trust is supporting. You are watching Change Lives for Good. This is Greg Kepferle from Santa Clara County Catholic Charities. Thank you. Welcome back to Change Lives for Good. I'm your host, Greg Kepferle, CEO of Catholic Charities of Santa Clara County, and I'm in conversation with Fred Ferrer, CEO of the Health Trust. And we've been talking about disruptive innovation. So Fred, as you've talked about disruptive innovation, it sounds like these are solutions that change systems. They're not going to be the most expensive. They may not even be the best, but it's good enough and it's cheap that it changes the way systems work. So as you look within the health system, especially around healthy communities, what are some of the disruptive innovations that the Health Trust is working on right now?
Well, we've done 2 rounds of funding, and we've done probably about 10 different projects, all different kinds of projects, some smaller scale ones to kind of some larger ones. One of our current ones is working with Breathe California, where we're looking at how would we take school buses, which are diesel-run school buses, which are polluting the air, especially around low-income schools, and make that solar-powered electric. How do we retrofit those? Right? If we could change all the school buses in our county to solar-powered electric buses by retrofitting the current bus systems, we would save the districts thousands of dollars in fuel and repair costs, but we'd also be improving the environment, right? If you start doing that to the whole system, then the way that we make buses in this country would start to change if all districts started to be able to do this. So you see the disruption as well as the innovation. But probably the most, I think, impactful of all of our disruptive innovations is our pay-for-success model, which is basically being able to say, we know interventions that work. There's lots of things in social services, a lot of services, we know what works. The problem is we don't always have the money to do it, or we don't have enough money to be able to get the full solution. So what if, again, in the disruptive innovation idea, what if we change the way the government contracts? Right now, the government will pay me for service. I provide job training, I provide a meal, I provide some service, and the government gives me money back for that. So it doesn't really matter, though, if I just keep providing those services, that's how I get paid. It doesn't really matter if the ultimate outcome to the community is what we achieve or not. And so in Pay for Success, we've said two things. One, what if we could do the innovative models that work? What if we could do them at scale, big enough so that they actually make a difference? And then how it would work if, in fact, the government paid me when I gave them the outcome? When I change that person's life, improve their health, for example, that's really when I get paid. So I get paid for the success of the client, not just for the service. Well, in doing that, then we're bringing in new ideas, new dollars, new funders, and kind of a new recipe of how the government funds work in our community. That will have a tremendous impact on all kinds of things. Where the county is looking at chronic homelessness, psychiatric care. Chronic homelessness is a huge issue for us to tackle. If we could raise $30 million in our community and really go after chronic homelessness, I know we could end chronic homelessness in Silicon Valley. We know we can do it. We have the right model. Now let's put the innovation together in a way that's disruptive enough to be able to serve us differently. That's the kind of thing that I think is really possible when you bring smart folks together who really want to innovate and disrupt so that you get the big systems change. You don't just kind of iterate on the slide where you just do little changes that are kind of nice, but they don't really change or solve the problem. They just kind of continue the problem and provide services.
Right, and with the pay for success model that we're working on together, which is really exciting, one of the things that I think is innovative about it is it's not just disrupting the government sector. It's also disrupting the nonprofit sector because we're so used to being paid in a certain way. But the other thing that it includes is it's disrupting the private sector. So both philanthropy and investors now can jump in at a different level and say, I'm going to invest in a social good and potentially make a return on that investment.
Right, and the social investment's a very different kind of concept. Most people are giving a grant and I provide the service. And if I provide that service, you've given me that grant, you as the investor can walk away and go, oh, that was good, but then what's the next thing I say? Give me another grant so I can continue the service.
I need more money.
Exactly. The challenge, though, is that's not going to, again, if we look at the new reality of what we think where we are, government, it's not coming back, services are going to increase, then that old model is not going to work in the long run. And we've got to look at how do we as providers of services provide those services differently. And so, yeah, we'll be disrupting both the provider side, the government side, and the philanthropy side, all in being able to solve problems. So it's not just like we're doing things worse and we're all kind of bearing it. We're actually going to get to the solution to some of the big challenges that we face. And that's the most exciting part of Pay for Success to me.
Yeah, it is tremendously exciting. It's also very risky, and we don't know yet if it will work. But that's part of what we're about here in Silicon Valley, right?
In Silicon Valley, we want to fail fast, right? If you're going to fail fast, is how you're going to innovate. And so we have to start thinking that way in the social services sector, so that social investment becomes something of a reality that we're solving problems. We're not just saying, oh, we can't take risk because we just have to do it the same way we've always done it. We know that doesn't work. If we want to get to solution, then we really have to start using our innovation mindset, which means we have to fail fast so that we innovate faster and make those improvements and change people's lives.
Yeah. So, Fred, you're very different for a foundation executive, that is engaged in philanthropy, because one of the things that you're engaged in is not just around healthcare and giving grants, to programs to have good health, but it's also this innovative perspective. So, get a little bit personal here. What what's motivating you? What's the passion that's driving your engagement as CEO of the Health Trust?
Well, I think CEO of the Health Trust is the best job in the world. It's a great opportunity to be able to use my skills and talents to make a real difference. So what does that mean? Well, for me, the Health Trust is an organization that has some resources. From the endowment, from the sale of the hospitals, that's what the Health Trust is. From the sale of Good Samaritan, San Jose Medical, South Valley Hospitals, that's where our proceeds came from. That's a great responsibility that this community gave us. They gave us the trust of their health. Literally, that's our name. So the responsibility to me is an awesome one, but it's a great resource. So for me, it's about being able to say, how do I use these dollars the best way possible? How do I provide the best stewardship of those monies? And I can't do it just by spending it. I have to do it by thinking of business-like ways, entrepreneurial ways of being able to sustain these dollars to have their greatest impact possible. It's my parents' background, it's my education, it's growing up as a gay man, growing up as a Latino. I have a responsibility to communities to be able to serve this community differently than just being able to say, hey, we've got some money to give grants, or we have some money to provide some services. We have too important a constituency for me to be able to relax in any way. And so that's why we try to take the responsibility and the stewardship that we've been given so seriously.
Yeah, the need is so great, and it's terrific that you're leading the charge with the Health Trust to help us address that need. One of the things that I think about in our partnership with Step Up Silicon Valley and the whole campaign to reduce poverty in Santa Clara County is your absolute commitment to the community. And having that partnership and having that commitment is so vital to making sure that we actually do create change here in Santa Clara County.
Well, one of the exciting things about the Health Trust is that we're an operating foundation. So we give $2.5 million in grants out a year, but we also provide services. So we have clients.
Right.
So I have a responsibility to a constituency of older adults for Meals on Wheels, HIV clients who are vulnerable in this community, kids who are going to the dentist, and, older adults who are really needing those services. So I have a constituency base as well, and that makes us as a foundation so very different.
Fred, thank you so much for joining us on Change Lives for Good. We appreciate you being here. This has been Change Lives for Good. I'm your host, Greg Kepferle, CEO of Catholic Charities of Santa Clara County. And remember to reach out, speak up, and change lives for good.